If you're one of the nearly 1.5 million Americans that will be diagnosed with cancer this year, perhaps the most important decision you'll make is where you'll turn for treatment. You're going to need people on your team with the knowledge, the technology, and the heart to help give this traumatizing news a triumphant ending. We'd like to introduce you to them today. Hi, I'm Janice Marie, and today we're talking to the doctors and patients of Texas Oncology, the nation's largest independent oncology practice, with more than 100 sites of service in Texas, New Mexico, and Oklahoma. This massive team of physicians are some of the best in their field. They utilize leading-edge technology. They're among the leaders in research and the development of new treatment options, and they're committed to nothing less than you winning the fight. Someone is diagnosed with cancer. There are a lot of providers out there to choose from. Why Texas Oncology? How do you set yourself apart?
The challenge of cancer care in Texas today is that there are many patients who are not close to a major center, and yet they have significant needs in terms of cancer care. Having a provider in their community that is able to offer state-of-the-art care as well as access to clinical trials is critically important. The benefit of a network the size of Texas Oncology and our relationship with US Oncology, which is a larger network still, is that patients can be shared with 300 or even 1,000 physicians.
I often see patients who have just been diagnosed with cancer. They have just within hours or days learned that they have this potentially life-threatening disease, and it's a difficult time.
I was in the emergency room. I was feeling really bad. Me and my wife went to the emergency room, and we couldn't figure out what was going on. The ER doctor came in and said, "You know what, I've seen this somewhere before. You mind if I run a test for a certain disease?" And I said, "You know what, Dr. Bad, I'm feeling anything will work right now." So he took me in and we did a test, and I came back. He broke the news to me and told me that I had cancer.
Most patients that come to me, they come with their whole family system, and they're at their greatest point of fear. They've just been told at that point that they've been diagnosed with some form of cancer, and their world as they have known it has been shattered. And so I am at a point where I can give them a lot of information and speak right to that fear. As a medical oncologist, I'm primarily the leader of their team in order to fight cancer. So I design the plan with regard to treatment, radiation therapy, chemotherapy, etc. So I'm responsible for kind of leading the fight.
I was stage 3. My kidneys were starting to fail, so I went straight to getting my kidneys taken care of so I didn't go on dialysis. And I went from there straight to, going to chemo, and somehow we were blessed to end up with our doctor, Dr. Berryman, who's with Texas Oncology. They left no stone unturned. The communication, the reassurance that they've given us, they were honest with us. They told us, look, this is a very tough cancer that you have. And I think that helped me and my wife put together a plan. I feel really comfortable with Dr. Berryman that moving forward.
I understand that Texas Oncology plays a huge role in pushing cancer research forward. Can you tell me a little bit about that?
We feel that clinical research is critically important for our patients. We have seen over the last several years in the United States that only a very small minority of Americans participate in ongoing clinical cancer research, and it's really cancer research that improves the treatments for millions of Americans who will in the future be diagnosed with cancer. So if we expect treatment to be better tomorrow, we have to be working with patients today to identify what's working well and where we need to have improvements.
There are 30 or 40 new drugs that are available in the last few years to address specific targeted cancer types. My expectation is in the near future that everyone's cancer will have essentially a genetic and protein analysis that allows us to break the cancer down, not to whether this is a lung cancer or a breast cancer, but to break it down to its specific genetic abnormalities. The progress that has been made is encouraging, it's exciting, but it's still not enough. And the only way we're going to continue to make that progress is to continue to evaluate new therapies through clinical trials and continue to be aware that we're dealing with patients, not just a diagnosis.
The fight against cancer is one the physicians at Texas Oncology are in to win. Who better to have on your team when you need them? Reporting for Close-Up TV News, I'm Janice Marie.
That concludes this edition of Close-Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com. I'm Jim Masters. Thanks for joining us, and we'll see you next time.